Good morning. Good morning, Virginia's healthcare advocates. Please take a seat or retire to the vestibule for your conversation, something like that. Okay, we have one bill before us this morning that I think we need to refer to the courts committee because it's legal issues, and that is Delegate Cole's 1733. Is there any objection to referring that bill to courts? And if not, it's been moved and seconded that we re-refer HB 1733 to the courts committee. All in favor say aye. Aye. Opposed? Thank you very much. This morning we are going to be graced by two speakers to tell us what's going on in the world. Our first speaker is the Honorable Janet Kelly. She's the Secretary of Health and Human Resources. She has a long resume here in Richmond. A lot of you know her, and she's going to tell us what's going on in all the agencies she is in charge of. So welcome. And if you want to tell us anything special about your background, something we didn't know before, here's your opportunity.
Well, thank you, Mr. Chairman. Thank you, members of the committee, for having me here this morning. It's a really dangerous situation to be the first speaker with no docket. But you've got a lot of important business to discuss besides me and hearing from Mrs. Faison as well. We did not coordinate messaging, but we coordinated our color schemes this morning. So you're in for a treat.
Yeah, very good.
It's just such an honor to be here. Thank you to each of you for your service, and please pass on my thanks to your family for all that they do to sacrifice to enable you to do this work. The Chief of Staff, as you know, was Secretary of Health before I was, and when he elevated into that role, some could argue it may not be an elevation, but when he did, I knew very early on that I had big shoes to fill. And if I tried to fill his shoes, it probably wouldn't work well, that I had to wear my own, but I'm definitely forging the same path that he did inside the Secretariat, one of service, one of professionalism, and I hope one of responsiveness to you all especially. I really appreciate the opportunity to chat with you. When Secretary Littell did this, he said the very first time he did it, he introduced himself a little bit and then talked about the Secretariat. So since this is my first time, thank you, Mr. Chairman, for allowing me to do the same. I was appointed to this role in July, but I've been in and out of public service for about 25 years. I began as a legislative aide in the same body 26 years ago this session. I met my husband in this very building, the old version. And in what might be my most significant but underappreciated contribution to the Commonwealth, I was one of the co-founders of Thursday Night Caucus. I did a short stint on Capitol Hill where it quickly became apparent to me that state government was where I belonged. States get stuff done. You all solve problems. And often you even get to meet and interact with the very people that you serve. I went on to serve as Chief of Staff in the Office of the Attorney General and then Secretary of the Commonwealth for Governor Bob McDonnell. About 2 months after I was sworn in, I met a young woman on a sidewalk at a mall. I didn't realize it that day, but that chance encounter turned my appreciation for public service from a generalist to one focused on health and human resources. This newly pregnant mom and those in her orbit added significantly to my knowledge on things like addiction, mental health challenges, domestic violence, poverty, homelessness, and the impact of trauma on bodies and brains. 2 years later, my husband and I became kinship parents of this little boy to avoid his going into foster care. When it became apparent that the reunification was not an option, we got additional education on the joys of raising a kiddo with special needs, the IEP process, finding, then waiting for the right specialist, the right meds, the right diagnosis, navigating the local community services board system, and finally, the adoption process. We also learned during this time about how Virginia was 50th in permanency, meaning more kids in foster care age out in Virginia than any other state. Their outcomes, as you might imagine, are dire, with a vast majority of them becoming addicted, incarcerated, homeless, pregnant, and even human trafficked. In the last year of the McDonnell administration, though my secretariat then had nothing to do with foster care, My husband and I ran a bipartisan initiative called Virginia Adopts Campaign for 1,000. This meaningful team effort, complemented by the team over at the Virginia Department of Social Services, resulted in 1,041 kids in foster care being matched with permanent homes in just 1 year. The 8 years in between the McDonnell administration and the Youngkin administration, my husband and I founded and ran a national and state-level nonprofit seeking to transform child welfare by engaging the community. No one subset ties together all of the agencies in HHR quite like a child in foster care. So I got a front row seat, both personally and professionally, to the wide range of work that this Secretariat does. By the time Governor Youngkin was inaugurated in 2022, I had personal lived experience with about half of the agencies in the Secretariat. Not as their secretary or supervisor, but as a consumer and as a mom. I was honored to bring all of this experience to bear and serve as special advisor to the governor for children and families for the first 2 years of the Youngkin administration, and to tackle one of the more challenging problems facing at-risk kids across the country and, of course, the Commonwealth. In April of 2022, the governor announced the Safe and Sound Task Force to end the phenomenon of kids in foster care sleeping in local social services offices, ERs, and hotels. Within 90 days of launching, by prioritizing and collaborating without spending one additional taxpayer dollar, the task force reduced the number of displaced kids by 89% in 90 days. Thanks to your support in the budget later that year, the task force, now led by Mira Signer, sustained that reduction at 76%. It was a beautiful example of what government can do when we work together across agencies to solve problems. That fall, the governor announced the Prompt Placement Task Force to reduce the waiting list at state psychiatric hospitals. Simply by coordinating and collaborating better, we reduced the wait by 20%. And of course, both of these efforts were buttressed and complemented by the governor's Right Help Right Now plan, which I worked on extensively when I was in that role. So, while I will only serve in this role for the last 18 months of the administration, it was an honor to work on what I believe is the most important, broadest, and largest secretariat in our Commonwealth. And I want to tell you a little bit about it, even though I know you're experts. Just bear with me. It's the broadest, it's the most important because it deals with our Commonwealth's most precious resource, our people. It's the broadest because of the wide variety of issues that it covers. So hang with me just a minute. This secretariat covers everything from opioids to oysters to obesity, from drinking water, which we'll talk about in a minute, to disabilities, to disaster relief, to domestic violence prevention, from adoption to aging to assistance, from long-term injectables to licensing to listeria monitoring, from communicable diseases to child welfare to the Office of the Chief Medical Examiner who certifies every death, from shelters to sewage to SNAP benefits to Selfish to state hospitals to safe sleeping to the Office of Vital Statistics who certifies every birth. Almost done. Lastly, the HHR Secretariat is the largest, comprising 35% of the state's operating budget at over $32.6 billion for this fiscal year. The employees mark 15,100, including an estimated 6,500 direct service personnel who service Virginians daily in our facilities and hospitals. I have a few of those employees who are in our agency leadership with me today, and I'd like to invite them to stand at this time and be recognized. If you're an agency head in HHR, please stand up and wave. These faces will probably look familiar to you. If they don't, they're available at any time to answer your questions and to be available to your constituents and to generally help you with whatever you need when they are able. So thank you very much for your service. Thank you. I also have members of the HHR Secretariat team here with me. You will recognize those as well. I'm not going to ask them to stand, but Leah Mills is your interface with the General Assembly. She's here. Hallie Pence is the Executive Director of Right Help Right Now. And then Lynette Walker is our CFO. And so I hope that you are getting what you need from us. And if you are not, please let me know. All right, as far as our priorities go, switching gears into the nuts and bolts of what we're going to be, I hope, working on together this session. We've got 5 bipartisan priorities where I think that we will have more than common ground. I think we'll have uncommon potential really to move the needle on a lot of these things. And those 5 things are maternal health, behavioral health, including fentanyl prevention and children's mental health, child welfare, long-term care, and infrastructure. All right, first, maternal health. In 2021, there were 64 pregnancy-associated deaths in Virginia. While that's a decrease from 82 in 2020, every single death is an incredible tragedy for the baby, for the family that is left in the aftermath of that. And worse, 80% of those pregnancy-related deaths are medically preventable. Maternal mortality rates are disproportionately high across Virginia. Rural areas face critical disparities in maternal health with limited access to care. And the prevalence of maternity deserts jeopardize the health and safety of mothers and babies. The disparities are even more prevalent for non-Hispanic Black women in Virginia, whose mortality rates are more than double those of non-Hispanic white women. This underscores the urgent need for clear data to drive and target clear action. As a result, the governor established the Task Force on Maternal Health and Data and Quality Measures. We've met 3 times, and we started with evaluating exactly what we're dealing with. And we really believe that with that number of women, we can take a targeted approach to this topic. We've had 2 sort of discoveries, if you will, that the 2 leading causes of this maternal mortality relate to cardiovascular issues and mental health. And we hope that our Right Help Right Now plan will address the mental health side. On the cardiovascular side, we're really pleased with that Cheryl Roberts, our director of DMAS, and her team developed a really innovative solution for the cardiovascular side. Anytime government finds a solution that is easy to distribute, cost effective, and also works, I'm gonna pay attention to it, and I hope that you will too. It's really simple. I hope that you will tell your constituents about it. It is called Ask About Aspirin. That's it. It's aspirin. And like I said, it works. In addition to the task force, Executive Order 11 supports healthier pregnant women, mothers, and infants by collecting this data. We've also directed an investment of $1 million already appropriated through the Office of Transformation to support the implementation of this executive director and to support the task force. We're convening a work group to ensure that every single pregnant mom covered by Medicaid is getting both postpartum and prenatal care. In addition to these executive orders, we've already allocated almost $500 million to support maternal health services in the Commonwealth. This year, an additional $4 million has been requested to improve maternal health by expanding perinatal hubs, increasing payments for psychiatric and I'm not going to try to say that, OB services, and residencies to increase maternal health workforce. As you all know, in every single part of the Secretariat workforce is a challenge. Improving maternal health outcomes doesn't always need funding, as I said, and I really just want to recognize Cheryl Roberts. Is she here? Hi, Cheryl, and her team at DMAS for this Ask About Aspirin campaign. All right, secondly, behavioral health with 2 subheadings of fentanyl and children's mental health. You all know so much about the Governor's Right Help Right Now plan. Did a little research on this, and don't hold me to the numbers specifically. I can get you better ones as we go along. But based on what I found, back during the 2007 Virginia Tech tragedy, the General Assembly allocated $49 million to Virginia's behavioral health system. After the unspeakable tragedy in Bath County involving one of our beloved senators and his family, the General Assembly allocated $149 million to behavioral health, 194, got those transcribed. Just to give you some idea of the scope of Right Help Right Now, thanks to your support and feedback and stories, the General Assembly has allocated $1.4 billion to Virginia's behavioral health system. And when I say that this is a transformation, it is transformation with a capital T and capital letters. I deeply believe that the experience with our system will be very different 3 to 5 years from now than it is even today, and certainly than it was 3 to 5 years ago. I just cannot thank you all enough for your investment in this initiative, and I want to give you a little bit of an update about where we are on some of the goals. As you know, it has 6 pillars. I think 5 of them are going exceptionally well. We have asked for help from you this year on the one that could be going better, which is Pillar 2, involving decriminalizing mental health and removing the burden of law enforcement on our citizens. But first, let me give you this update. We led a statewide dispatch system of mobile crisis response via the Virginia Crisis Platform. It's grown from 32 to 102 mobile crisis teams with 24/7, 365 coverage across the Commonwealth and an average response time of 50 minutes. So think about that. Where were we 5 years ago when you called 988, which didn't exist? How long would it have taken a team to get to your house to de-escalate the situation and to serve you? That looks completely different today than it did 3 to 5 years ago. We've invested $165 million into crisis receiving centers and crisis stabilization units. We've already allocated this money to over a dozen projects across the Commonwealth, making available 287 operational chairs and beds, and with another 320 in development. Additionally, in 2023, we restored all 254 state mental health hospital beds that have closed during the previous administration's staffing crisis. We implemented 988, and that call volume has steadily increased since late 2023, with more than 14,000 calls a month in July, August, and September. The second phase of targeted 988 marketing is in the final stages of development and will be rolled out here soon. Furthermore, Virginia now has over 100 mobile crisis teams operating. We have significantly expanded the capacity of these crisis receiving centers, as I said. And then this year, I want to talk about Pillar 2 that we discussed. We requested an additional $70 million to support the Right Help Right Now plan, and this is what it would go for. $35 million to expand special conservators of the peace. This aids with alternative custody while individuals are waiting placement for care. And this is coupled with $3.5 million for alternative transportation. My guess is we will get questions about this during Q&A if we have time for any. So I don't want to go into too much detail, but in retrospect, I will say on this topic that if I knew then what I know now, this would have been included in the original $1.4 billion ask. I don't think that this is going to be long-term at all, but it is a bridge to get us where we want to go while the full crisis program is being built out. It does remove the burden of law enforcement. It does decriminalize mental health, but it also and importantly changes the experience for the patient that is in the hospital. Instead of being with a law enforcement officer, they are with someone called a conservator of the peace. And so we're really hoping to work with you all on that this year in order to change that experience while we get the crisis system built up. We've asked for $4 million to support the readiness and implementation of an 1115 SMI waiver, serious mental illness waiver, $1.4 million to expand APAL, which is the Adult Psychiatric Access Line. If you all are not familiar with APAL, please tell your physicians inside your districts about it. It is a wonderful program that allows for real-time support in the doctor's office for folks suffering from a mental health challenge on site or a substance use challenge on site. $17.8 million to address children's mental health by enhancing mental health literacy, restoring funds to school-based mental health services, growing the workforce, and educating teens on the dangerous impacts of substance use and excessive social media use. Let me touch on the waiver system really quickly because I know that that is an area of interest for many of you, including you, Mr. Chairman. Last year, the governor proposed to eliminate the Priority 1 wait list with 3,440 additional waiver slots. This budget includes $4.3 million to monitor the larger number of waiver slots, ensure compliance with state and federal developmental disability waiver requirements, and support efforts to end the 10-year settlement agreement with the Department of Justice. In addition to that, we are proposing the reallocation of the management of unused waiver slots from CSBs to DBHDS. This reallocation will ensure that those slots provided by the General Assembly are used in a more efficient and effective manner. And by centralizing it, we think that we'll be able to logistically hand out those waiver spots in just a better way. All right. Under Right Help Right Now, I want to talk a little bit about fentanyl awareness. The governor touched on this yesterday in his State of the Commonwealth address. We've got a great story to tell on a really hard topic. As you all know, fentanyl is extremely fatal. We've heard a lot about how even marijuana that was perfectly fine to use in the 60s and 70s is now four times more lethal and also laced with fentanyl. It is in vapes, it is in joints, it is in all kinds of things that a young person, an adult, could touch or taste one time, and it completely changes the course of their life because it is fatal. And it's something that the governor has elevated, and I'm really thrilled to say that we have seen a 24.4% drop in overdoses and fentanyl-related deaths from 2022 on. We have distributed 313,786 naloxone kits, and we've revive trained over 441,000 individuals since 2023. Let me also say, you all will be getting an invitation to an event where you can get Revive training. How many of you have been Revive trained? No shame if you haven't. Okay, good. I have my kit in my purse that I carry around everywhere with me now, just like the First Lady does. I will just have to say, it takes about half an hour. It's well worth your time. If you have taken a CPR training, you can do this. It's much easier, actually. It is not a shot. It is nasal administered, and it's easy. And just like one pill can kill, one shot in the nasal cavity can save a life. And so I highly encourage you all. I believe it's February 3rd. When you see that invitation, please, please, please come. If you're not able to make it during session, we can come to you in your district and host one for you and your constituents. I have zero doubt that we have absolutely saved lives because of all of this training, because of the focus. If you're not familiar with the First Ladies, It Only Takes One initiative, please check it out. It's itonlytakesoneva.com. She ran a pilot in Roanoke last year, and 550 parents committed to talking with their children just in Roanoke. It was a highly effective program, raised awareness significantly in the community, and she has since expanded that program statewide to complement the work of the Virginia Foundation for Healthy Youth, the Attorney General's office. I did want to mention the Virginia Foundation for Healthy Youth have reached 1 million Virginia youth through their Deadly Dose campaign, and 450 youth through their Unfazed Cannabis Use Prevention campaign. We have put forward a budget amendment to ensure that general fund appropriation for the purpose of naloxone is allocated to the correct service area. This is important to make sure that high-need areas are receiving the resources that they need to prevent the maximum number of overdoses. Before I go to children's mental health, I was talking about Help right now, and I just want to recognize Commissioner Smith, who is here with DBHDS, who has done a great job, and his team leading this initiative. So Nelson, thank you. I'm not sure where you went. There you go. Thank you so much for all that you've done. And then Marty Kilgore with the Virginia Foundation for Healthy Youth. Can't say enough good things about the foundation. They've got their 25-year anniversary this year, and just do great work. It is an underutilized resource in the Commonwealth for you all as well. So please call her and ask and visit their website for all kinds of resources that will benefit you. How are we doing on time, Mr. Chairman?
Well, I think it's probably about time for members to ask questions.
Oh, I was hoping you wouldn't say that. I've got, do you want to hear about long-term care, drinking water, or foster care?
Oh, those are all three of my favorite subjects.
That's what I thought. Why don't I talk really fast, and I'll just hit the highlights.
Okay.
Okay.
Congratulations on the water situation and the administration's involvement in getting that solved, and we're looking forward to reading the report.
Thank you. We'll start with water, if that's okay. As you know, the Office of Drinking Water is in the Virginia Department of Health. Dr. Shelton is here. That agency is out of a broad secretariat, probably the broadest. They're the ones that deal with oysters to opioids and obesity. That was a tough week. I'm sorry that it impacted you all. I'm sorry that you had to get your work disrupted. Obviously, we're a locally administered Commonwealth, and so we're here to support localities. It's not our water system plant. We jumped in when we found out about it Monday afternoon. The Office of Drinking Water does have regulatory oversight of this treatment plant. We were on the ground once we found out about it from Monday afternoon until Saturday through the storm to make sure everything was done, and they will be working with the city on some corrective actions to make sure that not only are the problems found, but that it never happens again, we hope. And yeah.
All right.
The infrastructure here is just too important. While we're talking about water, let me bring up one other infrastructure issue that you all have been very supportive of, which is technology. It's one of those things, just like clean water, that you take for granted until something goes on. But our technology infrastructure in a lot of these agencies is becoming a workforce issue. What I mean by that is you've got, brand new, bright-eyed, bushy-tailed kids, really, young adults coming out of their master's in social work, coming to work for, let's say, a local agency in CPS, and then they get on and are asked to use a system that is older than their parents. Imagine the work that you all do here and doing it without your calendar, without Outlook, without your email, without a cell phone. That is functionally what we're asking our workers to do in the field. And so I just want to commend you all for the work that you've done.
Feel free to introduce, if you need some more money, and it wasn't in the governor's announced budget on December 18th, feel free to
The
tell
good
us
news
about it.
is it's already allocated, and I'm simply thanking you for what you've already allocated.
Okay.
Yes.
So no to-do list there. We're good.
No specific to-do
Okay.
list for now, unless my team tells me
All right.
differently. All right, let's talk about foster care and kinship care real quick, and then touch on long-term care, and then we'll do questions. Is that okay? I'll be quick. You tell me. I am at your service, Mr. Chairman.
But please, no. I know our foster care system. We have one of the smallest ones in the country, particularly for a state of our size. And you mentioned earlier we're not doing well on the aging out situation. So tell us how we're going to fix that. We need more parents to volunteer to be foster parents.
We do need more parents to volunteer to be foster parents, for sure. And like I said, my family was a kinship family and ran a nonprofit for 8 years recruiting foster parents. I do have some bright news on the foster care side that I want to share, and thank you, and then we'll talk about this year as well. The kinship bill that you all passed last year, I think is going to set the stage to allow us. I'm not going to say that specific bill is going to revolutionize foster care in
We
Virginia.
were trying to do that for years.
And we need to. And there's a lot of interest
Glad
in
we all
foster care.
changed our views on that.
Say that again?
We changed our views. I mean, people opposed that for a long time.
They did. And I may have been one of those people. I think that, 10 years ago, if you had said, should we pay relatives to take care of their own kids? I might have said no. I'm not sure. But we know the outcomes are so overwhelmingly clear, it's not even a discussion anymore. And that's why the bill was passed. So thank you. I will say that the new kinship placements, just since that bill, we were serving over 1,000 kids just since July, which is enormously successful. We have increased the percentage from 18 to 28.5% just since the Youngkin administration has started, which is amazing. We do have $9.2 million to fund foster care and adoption cost of living adjustments for those new foster and adoptive families. So please support that this year. The one area that I would just say needs some additional focus is our CPS units. Almost every article that you read, if you are reading about a child welfare case in the newspaper, it almost certainly touches on our Child Protective Services units, including the Henrico Doctors Hospital issue that we've been reading about in the papers. And I would just encourage you all to do whatever you can to support those. Let me also thank Director Williams, Commissioner Williams, who's here, and Director Ayers, Nikki Cox, her team, Eric in the OCO, the Children Ombudsman Office, for all of their hard work on this. That is another huge agency that does a lot.
We're very thankful.
Thank you. Okay, long-term care.
Okay.
And then I'm finished.
Okay, terrific.
Okay.
It's growing.
Say that again?
There's more. We have a higher demand
Huge.
and more demand next year than we have this year.
It's probably that in addition to the CPS, it's probably the topic, I sleep fine, but if I had a topic that kept me awake at night, it would be long-term care. We had other priorities that we had to focus on the first few years of the administration, but I think you'll see an increased focus on long-term care this year. The number of complaints have increased by 64% from 2019 to 2023. We do have some legislation and budget language to help us on this, and I would just encourage you all. One of them is raising licensing fees, which directly goes to our team at VDH to make sure that it's a good team and that they stay and retain that workforce. So I would just encourage you all. But we're 38th in the nation on a recent nursing home study. So.
Yep. Okay.
Thank you, Mr. Chairman.
Thank you for all the optimism that you bring to this job. It's It's really
I've only
good.
been in 7 months, so ask me again in like 2.
Okay. Well, that is a huge agenda, everybody, and we're going to take as much of it on as we can during this 45-day session. So, do members? We have time for maybe a couple questions from members if there are questions. And I've got a couple housekeeping things, and we've got our CSB representative here to talk about how this stuff gets done at the local level or doesn't. Any questions? I'm looking. Okay. Delegate Herring.
Thank you, Mr. Chair, and thank you, Madam Secretary. I do want to address maternal health, and I appreciate the aspirin program, but I would like to know what the governor's plan is in addressing comorbidities that exist, because giving an aspirin will reduce risk of blood clot, but it's more than that, because if a blood clot has happened, it could actually cause damage and congestive heart failure. So other than an aspirin, what is the plan for addressing overall health for the mother, and just especially if they're having symptoms of shortness of breath and elevated pulse rate? What's the follow-up? Thank you.
That's an excellent question. And we are fortunate enough to have an OBGYN as Commissioner of Health. So it would be malpractice for me to answer that question when she's 5 feet behind me. I have an answer, but I think you're going to be more interested in what she has to say. So Dr. Shelton, would you mind speaking to that?
Welcome, Dr. Shelton.
Thank you, Mr. Chair. Thank you for the question. There's a lot of comprehensive work going on for maternal care. I think it's really incumbent that we allow the healthcare providers, the OBs and family practice doctors and other healthcare providers, all the way from midwives and in every phase, to be able to work with their patients in the way that they need to. We need to make sure that our patients are educated about the signs of adversity during their pregnancy. And I think there's a lot that we can do to empower our pregnant women to understand what is going on with pregnancy and when they need to look for signs. Some of the things we're putting forward, such as the money for the perinatal health hubs, are examples of ways where women can receive education in their own community, in their own setting, where they can be empowered to have this knowledge about when does something go wrong and how do I need to contact someone for that. So we were looking comprehensively at making sure that women understand their health and can advocate. I think it's really important also that we help fathers to understand women's health, not women's health, but for fathers to understand all these things as well as families, because sometimes when you're the sick person, it's hard to understand what's going on with yourself. So I think educating our fathers and our families about what are these aspects that they need to understand as well, so they can help women to achieve their best health in that way.
So just a follow-up question, Mr. Chair, and I'll be
Delegate Herring.
brief. So in dispensing the aspirin, is there some literature information is given, because some people may not realize that there may be an underlying issue going on, and that's what I'm asking, because I hate for someone to just take an aspirin and say, I feel better, and then go on,
No.
and then there's an underlying comorbidity that's existing.
Absolutely. The campaign is for the patient to ask their provider about aspirin. So it's not for people just to start taking aspirin, because there is a lot of education. As you know, aspirin specifically will help reduce some of the hypertension, preeclampsia type conditions, but it is really incumbent that, as you mentioned, there are comorbidities. So the campaign is ask about aspirin. It means for a patient to ask their provider. So the provider should provide them that education that goes along. Is this right for you? This is a patient and a healthcare provider decision that they make together, is
Thank
whether
you,
or not that's
Doctor.
appropriate for them.
Delegate Hodges.
Thank you, Mr. Chairman. Madam Secretary, thank you for being with us and being here a number of years and seeing all the secretaries we've had in the numerous cabinets. I don't believe I've ever seen anyone as passionate about their job as you, and to take care of everyone in the Commonwealth and to solve problems. Always innovative, always looking for solutions. And what's next? How can we help? So can you just give us a little bit of update on maybe what's next? What are we looking at? Perhaps health literacy, which I'm very passionate about. And, and with health literacy, you're looking at everything from social media to understanding a prescription label.
Okay.
And there's a lot in between. So
that could be a long answer.
That's going to be a long answer, but
Yes,
just,
I'm hoping it will be.
What's next? And, innovative approaches that you may be looking at to solve some of the problems in the Commonwealth.
So I appreciate that. I can narrow it. actually, to one thing that you mentioned, Delegate Hodges, and I can touch on the others offline, but I do believe that there is one threat that's facing our Commonwealth's children that we have not discussed, and I did not discuss in my remarks, and that is the threat of social media. Our kids now actually have an attention span that is shorter than a goldfish. So think about, and so do many of us. I am the worst among us on this topic. So think about the impact of that on our workforce. Think about the impact of that on our military and on our national security, on our relationships, on our marriages, on our families. I deeply believe that if we do not do something about social media addiction, that we are going to regret it. And it's not going to take 10 years to do so. The suicide rates, the governor touched on this yesterday, the increases in diagnoses of addiction and anxiety and depression, of ED visits, specifically of adolescent girls, is also something that keeps me awake at night. We did have a summit last November called Reclaiming Childhood, where we're encouraging kids to be kids. If you haven't read the book called The Anxious Generation by Jonathan Haidt, I highly encourage you to read it. I think that it could transform a lot of what you do because it's going upstream and focusing on children's mental health. And so I would say if there's one project that I am the most passionate about out of all the other very clear duties inside the Secretariat, that would be one.
Okay, Delegate Tran.
Thank you, Mr. Speaker. Madam Secretary, I was reading in the news, I believe just this week, that we anticipate a dramatic increase in the number of people who have dementia. I think by 2060, we expect to have 1 million people, and after age 55, 4 in 10 adults will be diagnosed with dementia. You know, what are your thoughts on how we can best help reduce cognitive decline or support people who are caregivers for people experiencing dementia?
Well, that's a really important question. Delegate Tran, thank you. And obviously, just like mental illness, I don't know of many families who haven't experienced someone in their family with dementia. I think that it's a growing concern. Obviously, it touches a little bit about the long-term care challenges that I mentioned earlier. I also believe that it's kind of its own thing. It's probably something we need to pay attention to more as a Commonwealth. And certainly inside my Secretariat, I look forward to working with you on that. If it's something that you're passionate about. You know, I watched my own mom take care of my grandfather with dementia, and it's just heartbreaking. It's just a devastating illness, and so certainly deserves more of our attention.
Thank you for being here today and bringing so much energy to the job. And all these people here need to get back to work.
Yes, we do. Thank you.
And so, and we have, I'm going to make a few announcements while Jennifer Faison is coming forward. Jennifer is the president of the Association of Community Services Boards, where all the action takes place in real life. So, so I want to tell the members that on our next meeting on Thursday, think of something that interesting about yourself when you introduce yourself, because we're going to go around and tell Virginians who you are again and where you come from and what your interests are. I want to introduce our staff for the committee, our DLS staff, Legislative Services, Chandler Brooks and Hannah Yates. And Chandler, you're here. Can you, where's Hannah? Hi, thanks Hannah. Thanks for all the work you're going to do. These folks work really hard, as does our committee clerk, Susan Slow, right next to me, and Susan King, the room clerk. She's going to keep us all in order here. And in the IT support business, we got Daniel and Kiera. I mean, they may be out of sight, but there's a lot of folks that work to make this process run smoothly. It's frankly, it's the most organized thing I do in my life is come here. So, anyway, so members get ready for your Thursday introduction, and we have a special introduction today of our newest member, J.J. Singh from Loudoun County. Now, I'll make an exception if Mr. Singh wants to make an introduction today. We can go out of order for you since you're new here. I don't mean to shock you like that. We can wait till Thursday if you want. Okay, all right. Thank you very much. We look forward to working with you on the committee, the most important committee in the General Assembly, as we've learned this morning. Okay, Jennifer, tell us about yourself and what your organization does.
Good morning, Mr. Chairman, members of the committee. My name is Jennifer Faison, and it's my pleasure to serve as the Executive Director of the Virginia Association of Community Services Board. I am a Leo. I enjoy long walks in the park. I do call it my privilege to serve as the Executive Director because there are miracles happening in your communities every single day. They don't happen in a vacuum, and I'm going to talk a little bit about what your Community Services Board system looks like and some of the things that we're working on, and then what we're prioritizing for the future. Delegate Sickles, Mr. Chair, you asked me to kind of start basically because there are some new members and maybe cover some pretty 101 kinds of things that involve the CSBs. And so while I do that, for those of you that are very conversant in CSB land and know your CSB well, you can dip out and slay at Wordle while I work my way through this.
You can never know too much about your CSB. There's 40 of them, ladies and gentlemen, and they're all different.
Well, we're going to talk about that.
Okay, very good.
All right. And I'm happy to, if you want to hold questions to the end, that's fine. If something occurs to you while I'm talking, you're welcome to interrupt me as well. So as Delegate Sickles mentioned, there are 40 community services boards in the Commonwealth, and they are the public agencies that provide behavioral health and developmental disability services throughout the entire state. And it's worth noting that your CSB system is the only provider network that provides services in every single locality in the Commonwealth. So we have different ways that CSBs are situated. Some of them are single jurisdiction CSBs, which means that, for example, Chesterfield County CSB, those employees of that CSB are employees of Chesterfield County. So that's one way that a CSB could be situated. We also have multi-jurisdictional CSBs, where it is a CSB that covers a number of localities. So, for example, Hampton, Newport News, New River Valley, Mount Rogers, Middle Peninsula, Northern Neck. We have an annual report. I'm not sure if that was able to be passed out, but you can, excellent. Oh, I love it. So you can see in there kind of how the boards are situated, and the very front of it, the table of contents will show you which CSBs are in which regions, which we'll talk a little bit about too. So I'm going to refer to that annual report here and there. It is also available on the VA CSB website if you would prefer to look at it online. So there are over 15,000 employees in your CSB system, and together they served over 200,000 individuals in fiscal year 2024, which is pretty significant. CSBs primarily serve individuals who are on Medicaid and those with no payer source at all, which is why the community services boards receive state general fund dollars to do the work that they do. And we'll talk a little bit more about funding in a minute. The community services boards are also very closely connected to our state agency partners. So the entire system is a locally administered system with state oversight. And that oversight comes from the Department of Behavioral Health. So between DBHDS and the Department of Medical Assistance Services, those are our two closest sister agencies that we partner with, but we do have relationships with a number of other agencies in the Commonwealth, which again we'll talk about in a few minutes when we start diving a little bit deeper. So your community services boards are the public safety net, and as such, the General Assembly expects CSBs to prioritize individuals with the insurance statuses that I talked about earlier, so people who are on Medicaid and people who are uninsured, because the Community Services Board as the safety net may be indeed the only place that they can receive the services that they need to thrive in a community setting. And in addition to prioritizing populations of individuals who are on Medicaid or uninsured or underinsured for that matter, the community services boards also prioritize individuals with the most severe diagnoses. And we'll talk also about that in a minute. So that's like 10 minutes of other minutes that we're going to be talking about some of these things. The General Assembly has deliberately established CSBs as the single point of entry into the publicly funded system of care for individuals with behavioral health and developmental disability services needs. And the kind of line of reasoning there is that you want a public touch on public dollars. And so you will have greater insight into the Community Services Board system through that connection than almost any other provider type that exists in the Commonwealth. That single point of entry is achieved largely through the targeted case management role and until recently the role of the CSB pre-screening evaluators. Now, the majority of the individuals, and this is what I was talking about when I said that the General Assembly has asked the CSBs to prioritize certain individuals, the CSBs generally are going to serve, the majority of the folks that CSBs serve are going to, on the behavioral health side, they're going to have serious and persistent mental illness, they're going to have serious and persistent substance use disorder, and they're going to have serious emotional disturbance if we're talking about the population of youth that the community services boards serve. And you can count on a significant number of the individuals in those populations having co-occurring conditions, which means they may have a substance use disorder and serious mental illness, or indeed developmental disability and a substance use disorder, which is something that we're seeing more of over time. These are individuals that have incredibly complex and chronic conditions that significantly impair their ability to function, and they require service provision that engages all of the partners in the community. And that's really the value of your community services board. They're going to bring together all of the stakeholders in your area when there are problems that need to be solved that are relative to these populations. And that is, these are partners from housing, folks who administer and find housing, to education, to the Division of Motor Vehicles so that we can get IDs for people, and also includes drumming up employers who would like to employ individuals with developmental disabilities or behavioral health conditions, to hospice, and on and on and on. The CSBs touch people from the cradle to the grave in your communities. And the community services boards are proud of their decades of experience in serving these populations. They pride themselves on their recovery-oriented, person-centered, and trauma-informed programs. And that is thanks in large part to funding that the General Assembly over time has provided to the CSBs. And the next thing that I'm going to talk about is everybody's favorite. If you've seen one CSB, you've seen one CSB. And so you're going to hear, if you haven't already heard that, you're going to hear it. And what I would say, and this is not a counter argument, but it is some context, that CSBs are more alike than they are unalike. They are absolutely united in their mission. They all have the same mission to achieve. They just have different resources with which to achieve that mission. And so that is really where the community services boards, the main place where they differ. And then there's the other part of it where the community services board, their part of their mission is to make sure that they're being responsive to the specific needs of their communities. So I'll give you an example of that. Every single CSB, because of the STEP Virginia initiative, and we'll talk a little bit about that too, every single CSB has services that are specific to military veterans and their families. But the way that happens, let's say in the Tidewater area, the Hampton Newport News area might look different than it does in an area of the state where there's not a high concentration or as high a concentration of veterans, active duty, military, and families, right? So you can agree that veteran services are an important part of the mission, but also accept and hold at the same time that the provision of those services is going to vary from one CSB to another based on the population that's in that community. So while again, it might look different, the mission is the same. They're just responding to the needs in your communities.
Okay, Jennifer.
Yes.
We need to kind of wrap up and let the members ask questions a little bit. I encourage every member of this General Assembly to get to know the leadership of their local CSB. That's really important to get a hometown view of what's needed. But we've got to move on through the day. So
Yep.
I wonder if the members have questions, please jump in right now or hit your speak button if you'd like to ask a question about how this works. I'll start out asking one. And I'm sorry, but time is limited. Tell us about on the waiver issue. All of us want to meet this very aggressive goal to get 3,440 waivers out in 2 years, and understand you're on schedule. Or the state is on schedule distributing them to your members. So tell us how it's going implementing these waivers on the ground and what you need to make that happen.
Sure. Appreciate and value your time. I was loosely keeping track here on my phone to make sure I didn't go over my allocation. The 3,440 slots, unprecedented, historic investment in DD waiver services. Love it to death. So there are 900 slots that were approved in August. Just because the General Assembly says, let's go, we still have to get approval from CMS, and so that process takes a little bit of time. And 822 of them have been assigned, so Delegate Sickles, as you suggest, we're kind of on track for that. And about 179 of those individuals have a service authorization at this point. And why that matters is because there's a limited time from the time an individual is assigned a waiver slot, which, by the way, provides access to an array of community-based care for individuals with DD. So that's the waiver slot. It's how we define and pay for waiver services. And so the active authorization matters because there's a limited amount of time for an individual or family to actually initiate service once they are assigned a slot. And they have up to 150 days to do that. And our goal is to make sure that they are authorized for a service within that time period so they don't lose their slot. Okay. And so the number of slots that we're actually bringing on, this a quarterly slow roll for the implementation of these thousands of slots, the number that we have brought on or will be expected to bring on in this first quarter is about a normal number of slots. And so we can see that is going as it normally would. I think where the pinch will come is in these out quarters where we don't assign the slots and then wait until the next tranche of slots comes on. We assign these slots and then assign some more slots and then assign some more slots. And so at some point, we're going to run into issues with provider capacity as well as support coordination. And so the Virginia Association of Community Services Boards, and you'll see in the back of your annual report, also on our website, has a list of our priorities. One of them is for $8.7 million in funding to support the onboarding of support coordinators, which is the kind of pivotal role, the hub, if you will, of the wheel that will allow people to get the services that they need. And rather than look at it by FTE or positions, what we have asked for is funding to support the gap between when you give somebody a higher letter, and when they can actually have a full caseload and begin billing for that within the CSB system.
How many cases would it be reasonable for a support coordinator to handle? And 100, 40,
Yeah.
20?
Yep. I can give you an easy answer that isn't accurate, and I can give you a longer answer that you might
Just
not
give me
like.
the short answer.
The short answer is probably about, I would say 30 to 35. The data would tell you it's lower than that, but there are different ways of allocating a caseload. Some of the CSBs use a weighting system and.
See, I can tell you in Northern Virginia, the sport coordinators have a whole lot more than 30 cases each.
Absolutely.
Yeah.
Yep.
Okay. So I'm very sympathetic to your request here we'll see what happens, how much we can afford, but we really need to help you in that area. Okay, we have any, I don't see any lights here for anybody who wants to. Okay.
Can I just draw your attention to a couple things? The last few pages of that annual report also will speak to the funding mix, which I know is important to you all, and thank you.
Thank you. Go, please.
Yep, that's it.
Okay, well, then I will continue. STEP Virginia, you know, we want same-day access. Sometimes we've learned it's same-day access to get an appointment 2 weeks from now. So how are we doing on same-day access, and are we funding it adequately?
So same-day access, it was one of the very first steps of STEP Virginia, which increased the number of code-mandated services for the CSB from 2 to 11. That happened in 2017. Funding began in 2018. For same-day access, each CSB, regardless of size or budget size or population served, received $270,000 to initiate same-day access in their shop. And so the model for same-day access, the part of what we struggle with is a perception problem. So somebody says same-day access, and people tend to think that means you walk through the door, you say hi-de-ho to the person at the front desk, and you walk into a psychiatrist's office, you plop down on the couch, and you start your services. That's not what same-day access is. It's not what it was intended to be, and that's not the model that we have. And so what same-day access provides is walk-in capacity for an assessment of that individual's needs, and then a first offered appointment within 10 days, and so a service appointment. And that appointment could be, for example, if you qualify for case management service, it could be a case management service. Not everybody is going to need the same intensity of service level. When CSBs initiated same-day access, what they did was they followed a nationally recognized best practice model, which said you need to observe how your waiting room is looking and how many people are coming in, how long people are sitting in your waiting room, what your current capacity is, so that you know how many clinicians you need to have available, because you can't know how many people are going to walk through the door and want that assessment. So you have to be able to grow and shrink according to who shows up in your waiting room. And it also doesn't mean that you won't have to wait some period of time in the waiting room. So it's not like you walk in and you may need to spend some time in the waiting room because of the way that works. But what it does do is make sure that an individual who may walk in for an assessment, we understand if they happen to be in crisis in that moment, we can help them right then and there. We're not going to wait. And so that has been very helpful in the communities as well. And the last thing I'll say about that is that we also received some comments and criticism about the fact that it's not same-day access is not all day, every day, in every clinic site. And I would just call your attention back to the fact that you look at your business flow. And so if you have 2 people in your waiting room at any given time at one of your clinic sites, you may not want to have same-day access hours available. You may not want to have a clinician dedicated to that if you're only going to have 2 people come in an 8-hour period. And so you would limit the number of same-day access hours or number of days. But certainly CSBs are interested in expanding that capacity.
Well, thank you so much for coming today. And the members, Ms. Faison's easy to reach. And I encourage you, when you have questions about how things work, and that's what we really need to be about in this business, is figuring out how things work, and we're always trying to make them better. There's a lot of room in all this issue set to improve our performance. And so we've got to work with our localities in the local government to make this work more smoothly. For our newer members, you'll hear a lot about this from your constituents in various different contexts. So I want to tell the audience and the members that the subcommittee assignments will not change from last year. And Delegate Singh will be filling in for our new senator who's been elevated to, well, I shouldn't say that, who went to the Senate and down the hall. And on the Health Professions Subcommittee and on the Social Services Subcommittee. And our chairs of these subcommittees are the same as they were last year. Delegate Willett will be heading up Behavioral Health, Delegate Hope, the Health Subcommittee, Delegate Price, Health Professions, and Delegate Tran, Social Services Subcommittee. So let's have a good session together, everybody. We won't be here very long, but we need to get a lot done. Thanks for coming. Thank you. Good to see you. Have some fun. Yeah.